themselves, they feel disconnected from the baby. Again, you can see risk factors up on the screen for that. Dads can also experience postpartum depression. So again, especially if their partner has postpartum depression, it can increase their risk of having it as well. So early recognition of symptoms is really key. And again, that goes with that discharge discussion with the family, going home. It's also the providers, right? As mom brings the baby in for its well check a couple days later, the pediatric providers are screening mom, right? And they don't even know it. So they're screening them to check and see, how they're interacting with their baby. As they go for their follow-up, their OB is going to be looking to make sure that they're interacting and not kind of showing signs of these as well. If they need it, or if on a screening tool they identify postpartum depression, again, there's many different ways, like they talked about going through counseling or therapy, support groups. We can use medications for them as well, but again, we want to make sure that we're cautious and talk about side effects and being able to breastfeed. So again, when we think about like Paxil, Zoloft, they can take that and still breastfeed with the baby. It doesn't pass through, it doesn't affect the baby. But again, we want to make sure that the benefits are really going to outweigh any of the risk factors there. Sometimes, as we shared in our simulation day, that sometimes there are losses that occur, whether it's somebody who, like my sister, experienced it during pregnancy. Sometimes stillborn babies happen. So again, thinking about supporting that mom too during that time period. All right, 3 hours after vaginal delivery, the client reports increased perineal pain. What should the nurse do first? So again, thinking about our priority questions. Are we going to assess the perineum, administer analgesia, apply ice, or perform perineal care?
Assess.
Yeah, assess. All right, we're gonna go ahead and take our break now and come back and